Hey everybody, welcome to Implant Training Egypt. I am Ali Abdelatif. I am a UK-based implants dentist, qualified in 1998 from Alexandria, Egypt, and then returned to the UK to my place of birth to train in the NHS as an oral surgeon in oral surgery, and then a master's in implant dentistry in 2005 to 2007 from the illustrious King's College London. I've been practicing implant dentistry and running short courses over the past 15, 16 years. And I have the privilege of now initiating and collaborating with Dr. Amr Amin, who is the head of the oral surgery department at the British University in Egypt, where we hope to take dentists out to train them in implant surgery and potentially restoration as well. We're starting our course on single and multiple implants, so sectional. We may have the opportunity to do full arches, but we're starting with basic implant training, which is what would satisfy the training standards requirements for straightforward placement. A little bit of GBR maybe, a little bit of bone grafting maybe. But we're sticking to the absolute basics to start with, and we may then progress to full arch treatment. So I'd like to introduce Dr. Amr Amin, the head of the oral surgery department. Dr. Amr, how are you, sir?
How are you? Thank you very much for this. Thank you.
So, Amr, can you give us a little bit of your background as well? Tell us where you qualified and a little bit about your speciality.
All right. I'm basically trained I've qualified and trained here in Egypt for most of my life. That was in Ain Shams University, and later after I finished my residency, I had another chance of doing an oral maxillofacial residency in Nasser Institute Hospital, which is one of the biggest hospitals treating trauma cases and mostly maxillofacial practice. Then I went on and I've had an observership in Glasgow University in the dental faculty under Professor Ashraf Ayub. I also had fellowship training in the University of Basel, Switzerland.
Impressive.
Cur currently I'm an associate professor of oral and maxillofacial surgery. My special interests have always been orthognathic surgery, trauma, and implant dentistry. The part of implant dentistry that I'm really interested in is how you could rehabilitate deficient ridges using bone grafts or sinus lifts and that sort of implant practice.
That's amazing. So I'm assuming that your colleagues at the university and the department have similar backgrounds to yourself. I mean, one of the things that candidates are looking for, if they're thinking of coming out to Egypt, is are people as qualified as you in your department? I mean, how many people would you have, for example, if they come out to do mentorship with you?
I'm very lucky in the department. I have 7 colleagues who have had similar training. Most of them have had their basic training in Cairo University, which is one of the oldest universities in the Middle East. Most of them are PhD holders, and of course, most of them have research topics that are mainly concerned with implant dentistry. Several of them have memberships from the Royal Colleges.
Amazing.
So I think I'm very lucky at the department. We have an assortment of really good practitioners who are professional in teaching and in mentoring others. I think that if somebody is concerned with that particular area, I think he'll be very satisfied when he comes to Egypt.
And tell us, I understand that you also have a collaboration with Sheffield University, or was it Sheffield Hospital or Sheffield University, is it?
Yeah, we have a collaboration that's now going into its second year with the Sheffield Implantology team. We have a formal course that extends for 1 year, and we call it the Fellowship of the British University in Egypt in Implantology. Uh, the program has finished its first cohort. We have 20 students. We had 20 students in the first cohort, finishing up next May with a Viva. And we're going to have the team from Sheffield come to Egypt to perform the Viva and start the second cohort. The second cohort starts in May, and I think we're halfway booked for that.
That's amazing. So this is something that may interest some of our candidates. They might be interested in doing that fellowship. It might benefit them, you think? That's something they could do?
Well, the fellowship is designed for dentists who want to increase their skills and knowledge about implantology.
And can
It's
they be
also
UK
based,
based? Can they be
yeah.
UK based?
That's the good thing about this fellowship. It's a hybrid style of learning. So most of the lectures are webinars that are available on a special web page that the university
Right.
provides you
So
with
they needs a
access and password.
subscription, yeah.
But then there's a whole there's a large amount of time dedicated to manage patients because we require for the candidate to enter the Viva at least 8 restored cases, and we provide them with time because we spread the entire program over a full year. So it is possible if someone would attend the lectures online and would come into focused like missions to perform the implant placement and then come back for the restorations. It can be arranged, yes.
Okay, that's great. So that's your formal course. So what we're doing with Implant Training Egypt is we're taking into consideration that a lot of our colleagues, our younger colleagues, they have very busy jobs. They're working in the NHS 5, 6 days a week. They're trying to earn a living. At the same time, they want to improve, they want to progress. So what we're trying to do is we're trying to condense a ton of knowledge for them, some implant knowledge and training into 4 or 5 days. So in terms of the university itself, can you give us a little bit of background about the university to present to our potential candidates where they might be coming to? I mean,
Well,
what's the British in British university? Is that just made up, or is it because there is genuinely something British about it?
it was actually inaugurated by, at the time, Prince Charles, who's currently King Charles.
Okay.
And there is a formal collaboration between the university and the British Council in Egypt. Also, several faculties have dual degrees. So they give one degree from Egypt and they get another degree from England. And that includes a collaboration with the Manchester Metropolitan in Arts and Design, and I think London South Bank University in the fields of business management. When it on the aspect of dentistry, we are seeking collaboration with different universities, but we haven't yet established that. So we only have the one collaboration with the Sheffield through the program, and another collaboration with the King's College, where currently we have an intern exchange program. So our interns get
Yeah.
to attend
Yeah.
some of the
I know what you're
VT
talking
rounds
about
in
because
England.
I ran one of those when I was at Alexandria. We had some interns from King's College come, and I was their host. They did
Excellent.
very little dentistry.
Yeah.
So that sounds amazing. So I think what we've established, we'll put some pictures of the university up on this webinar, so that people can get an understanding of. I mean, I visited myself. I was amazingly impressed with the level of modernity. It's obviously all spanking brand new. The decontamination zone has a ton of autoclaves, staff that clearly know what they're doing. Um, and it was an absolute pleasure to see. Um, from the cases point of view, so let's say now that a dentist has decided to give up his time. He's going to come out to Egypt for 5, maybe 6 days, including travel. Can you give us a sort of an understanding of what types of cases they will do? And I mean, you guarantee, I don't want to use the word guarantee because, things happen. But I mean, what's your level of confidence in that they'll be able to place the 7 to 10 implants that we have promised them on our website? Is there a potential for them to do even more than that? And what sort of level do you think, is there going to be a lot of GBR, sinus grafting, etc., etc.?
Right. So in terms of what we're doing to cover these areas. So we're trying to assimilate as many of as cases as we can. So we examine them, we diagnose them, we order a CBCT for them, and sometimes.
Sorry to interrupt you. So you're gonna prepare the cases before the
Yes.
candidates come along.
Yes, we've
Okay.
established a waiting list, and we're keeping it at hand in the department. We established a waiting list with patients who have
So
performed
you've already got a
extraction.
waiting list. Okay, cool.
Yes.
So, Dr. Amr, we were talking about the university, and you explained that it's based upon collaboration with the United Kingdom. You have multiple departments who collaborate with the University of the United Kingdom, and you yourselves are in collaboration with Sheffield and in talks to establish collaboration with King's College. So I think we've established that you are a university with good backing, with good equipment. Photos of your university are on our website, and photos of your department. Can you tell us a little bit for the potential candidate? What types of cases will they be doing? Will it be limited? Do you genuinely have a number of cases ready to go? How will they prepare for it? What type of work does the candidate need to do in preparation? Go ahead, sir.
Yes. Well, as I was telling you, we're a department that's well acquainted with implant dentistry and all the procedures of basic and advanced implantology. We've started about a year ago assimilating cases that are requiring implant treatment. So we prepared them, diagnosed. Most of these cases have been diagnosed, received the CBCT, and at least we have a tentative plan that we can discuss once you have your candidates over. Now, of course, I would guess that most of these cases will require guided bone regeneration, because people don't go for extraction unless there's like been considerable amount of bone loss. But also simple and straightforward cases are available, because the department performs extractions on a daily basis.
Right.
So I mean, we have simple cases as well as the advanced cases.
So for the patients who say have had extractions, you can say to them, you might be saying to them, come back in 3 months' time, we can do an implant for you. And other patients you say who've had extractions months or years ago have resorbed ridges, and so technically you'd be able to provide us with recent extraction cases and delayed cases requiring GBR. Is that correct?
It's correct, because we offer the implant treatment option for every patient who undergoes an extraction procedure.
Right.
And most of the time, it's only the economic limitation that really keeps the patients from doing that.
Great.
But otherwise, patients are well informed of the option of having an implant restoration once they've taken the teeth out.
Great. So I mean, sorry to keep piping on the same question, but this is a question that a lot of candidates or potential candidates would have. Is it going to be all singles, multiples, full arches? How many? Are they going to make their 7 to 10 quota? How is it going to be logged? Can you answer those questions for us?
Yeah, I can give you a round figure of that we extract on a daily basis from 35 to 48. We receive from 35 to 48 patients on a daily basis, extracting either single or multiple teeth. So that's just one area of how many patients. I mean, this is just to give a round figure of the volume of cases that we have.
Yeah.
Also, we as I told you, we started to assimilate cases a long time ago. So we have a waiting list that's at well over 30 patients. Some
Right.
of them are singles, some are multiples. And I would reckon if someone is coming over to learn about implants, each candidate would be a good idea to do both single and multiple units. It's like there's a learning curve.
Yeah, for sure. Yeah, because they need to know how to distribute between them.
For everything. Yeah.
So do we have guided options? Do we have guided option available at the university?
We have the cone beam CT is available. We have intraoral scanners. We can print out guides. We can outsource them. We can either do them ourselves or we can outsource them. So I think that will
Okay,
not
so
also be a
maybe, I
problem.
mean, the way that I would see it is that probably on day one and day two, we want to teach the absolute basics of implant distribution, positioning. They need to really understand how to drive manual first before they then look at guided. But there's a good opportunity here to candidates listening that we could potentially, on say day two, at the end of day two, plan a couple of cases guided, and then potentially do them the next day or the day after that in the guided format to give them that experience. So that would be amazing. I mean, if that's something that we can potentially do. Okay. So, Dr. Amr, can you tell us a little bit about the actual didactic teaching that you were mentioning, and are there going to be structured lectures as well on this course? And what is didactic teaching? How do you provide this education? What is your process?
Right. So we have two sets of lectures that we're going to focus on. So one set of lectures will be covering those basic principles, the knowledge that you absolutely must have so you can start practicing implants.
Right.
That's one part of the didactics that I think is quite important. The other part is really based on the more modern way of teaching. So that will be discussing the case in terms of the planning of the case, the reflective points that we got from the case, what we needed
So
to
for
highlight
each
or
individual case, one on a case by case
yes,
basis, you mean?
on a case by case basis, because that's how we really learn. That's really how you assimilate the knowledge and you start like formulating your own blueprint for how to place your implants. And I think that group discussions and reflective thinking are one of the best ways to actually come up with good conclusions and come up with a good workflow that you will follow in your clinic after that.
Great, yeah. So that's the thing, because, I mean, even me today, after 16 years or 17 years of doing implants, you're constantly learning and teaching and reflecting. Every single case is different. You can be doing, say, a multiple implants case. One of them is an immediate extraction and placement. The other one is a delayed. The other one needs GBR. The other one, needs the primary stability wasn't great, so you have to submerge the implant. So you're right. So even so, the knowledge is huge, and it's important even in straightforward, in simple what are considered simple implant cases. You need to have an understanding of multiple different disciplines to just handle even that level of simple implant cases before you move on to more advanced and complex stuff. Um,
Exactly. I
in
agree.
terms of, I mean, in terms of sinus lifts, for example, so sinus lift is a big subject, and I'm 100% sure that you do that, I do that. So, between the two of us, or the three or four of us, will be able to demonstrate these. I Do you get a lot of those cases? Do you think that we'll have the opportunity to perhaps even walk one of the candidates through, or a few of the candidates through, sinus lift cases?
We definitely have a lot of these cases,
You do,
at least one or two a week.
right?
That's like definitely. But what I would recommend is to aim for covering all the basic points before we go on to those. We can, of course,
100%.
always cover them. I mean, in lectures and in videos, and we can do that.
Yeah,
But if it's only 5 days, at least for this first visit, then maybe we focus on doing the
yeah,
basic cases.
getting the
We could, of
basics right.
course, as you said, we could demonstrate one or two of these cases, but that
Yeah.
depends on really how we time manage things. Hopefully, we can do that. But as regards to cases availability, it's like highly available. Yes.
Great. Well, maybe then in the future, once the candidate has become an alumnus of the university, they might return for further cases. Hopefully, we'll stage some further cases for advanced implant dentistry, bone grafting, full arch, etc., etc. Sounds good.
Yes.
Um, so, what about the restoration? So in terms of fulfilling requirements, we know that you have very kindly said that if the candidate can't return, that you will take over the restoration. You have a prosthodontics department who would do that. But let's say that the candidate wants also to restore implants. do you think that there might be the opportunity, even for our very first cohort, to be able to give them the opportunity to restore maybe 2 or 3 cases, even if it's not the one that they've placed, not ones that they've placed? And then the second question is obviously, would those candidates have the opportunity to return, say in 3 months' time, to perhaps scan or take impressions and then restore the implants that they themselves have placed, so that they can fulfill their logbook requirements?
Well, actually, I would recommend that they come back for a second visit and do the restorations themselves, because as you know, there's part of the learning curve about implants is how you restore your own implant. It teaches you a lot about the implant position, about how to consider your
Yeah,
PINC aesthetic score and your and the quality of the healing around your implants. There's a lot to learn in that aspect. So I would recommend that they come back for a second visit to do that. But let's just say that if someone from the first cohort came in, placed in the implants, and would not be coming back, we would definitely be taking over the case, finishing it up with the orthodontics department, and we have an understanding about that. Also, for me, it would be quite beneficial, because actually, if any case has an implant hasn't been restored, I would definitely include it in the program that I told you about, the Sheffield Collaboration Program, because this is an opportunity to teach those candidates about how to restore the cases and about implant position.
that's great.
So my main objective here is not only to provide the implant training for the candidates who are coming in, I'm also really interested in providing high quality, top notch service to those patients who are economically unfortunate and would need that kind of economic support to place in the implants. And that's very critical to me, is that these patients feel that they're being treated as they should.
That's amazing. I'm sure I myself feel very, very proud of you saying that, delighted that you're saying that. I'm sure our candidates will be pleased to know that it's not just some third world country just chucking in implants in people and sending them off back into the street. So that's great that you respect the dignity of the patients, and you're going to be treating them at the same level as any patient anywhere worldwide. We touched on the subject of aseptic technique, and we know that we will be practicing implant placement under the same conditions that would be required of a dentist in the United Kingdom following the aseptic technique. That's amazing. And then finally, can we just get an understanding of what kind of a certificate they would get, and sort of the quality control for the certificate? So, being a university, my understanding is that this is a certificate from the British University in Egypt that can be presented worldwide as officially recognized training. Can you confirm that for me?
Well, the School of Continuous Education has issued new certificates with watermarks that can be presented anywhere in the world. And we're going to include an entire description of what we've done,
Right.
a sign that we're going to sign off all the cases.
Yeah.
So in that sort of documentation, I think will be completely covered. Yes.
Fantastic. I'm delighted to have quizzed you on all of these subjects. Let's talk about the fun side of things then. So, what have you got for us?
Yes. Well, I've got your candidates are very lucky, because you're Egyptian, so you already know where the excursions that should be
Yeah,
visited are.
that's true.
And
Yeah,
you gave me a hand-picked list, and we've arranged that with a travel company. So a lot of excursions in the old parts of Cairo. All the historic mosques are going to be included. Some of the newly opened museums are also included. So
amazing.
so it's not only going to be all work, we're also going to have some fun on the side. Um, and I really look forward to that kind of experience. It's going to be great.
I very, very much look forward to it, sir. I'm very grateful for your time. I know you had to rush home today to do this interview with me. Hopefully, it will catch the interest of a lot of young implants dentists or young budding implants dentists, and we'll bring them out to see you and see your fantastic department and get some really good teaching.
That'll
Thank
be
you.
my pleasure. That'll be my pleasure. Thank you very much.
BUE.